So what we're going to go ahead and do, pull up and out, so it's opened up, and everything does look, it looks pearly white to grayish in here, okay, which would be normal for her, okay. Just a little bit of hair, and sometimes you're going to see a little bit of wax too once in a while, which that's normal, okay. All right. And then we're going to observe your nose. So, palpate the nose, which it does feel equal and even. Palpate the bones around the nose. Okay. And then what we're going to do is go ahead and I'm going to have her raise her head just a little bit. And then I'm going to tilt her head back with my hand so it's steady. And her septum is straight and it is midline. And then I'm going to go ahead and just check further up in here. Sorry. Everything is pink, it's moist. Okay, so that looks good for you. You haven't had any problems with your nose or your sinuses or anything? Okay. Next, we're going to move on to her mouth. And, of course, your lips look fine. There's no lesions around your lips. If you could just go ahead and open your mouth. Okay. Tilt your head up just a little bit. Okay. I'm actually going to use this light to check the inside of her mouth. Okay. There's no red marks, no white patches. And did you have your tonsils out? Okay, and she doesn't have her tonsils, so I can't really give her tonsils a grade. Okay, her gums, they're fine, they're pink. Okay, and I'm just going to pull your tongue from side to side. Okay, if you could stick your tongue out. Okay, I'm just going to check under the tongue. Okay, and of course the top of her mouth should be shiny and pink, which it is. The last thing to check for this is your gag reflex. Do you have an easy gag reflex? Okay. All right. We'll just check and see. Okay. Very good. All right. Next, we're going to move on to the neck. Okay. And I'm going to just put my hand here. Turn your head towards my hand. Okay. Towards my other hand. All right. Can you move your neck from side to side to your shoulders? All right, shrug your shoulders. And again. Okay. I'm just going to go ahead and listen to your carotid artery. Palpate for that first. Okay, and also check for your tracheal position, which it is midline. Okay, your lymph nodes. All the way down to the clavicle, which that is fine. Okay, and then I'm going to go ahead and check her thyroid, which you stand behind the patient to check that. All right, go ahead and swallow. All right. I noticed your thyroid seems a little bit enlarged, kind of over to the left side. Are you familiar, or do you know that that's like that? Or okay. All right. Well, I'll make a note of it to let the doctor know. All right. I'm just going to go ahead and check out your musculoskeletal here with your arms. Any soreness, any change in how you can do your daily activities? No? Okay. All right. Are you able to place your hands up? Put them together at the top? Okay. How about behind your back? And clasp them together. Okay. If you want to go ahead and put your hand on the table, or put your arm on the table if you can. If you want to stand up, you can. Okay, and put pressure against my hand. Okay. I'm just going to hold your hand, make like a bicep fist, and pull. Okay. All right. And also, I'm going to assess your pulses, both radial and brachial.
Sorry.
Okay. And I'll count that for a full minute. Okay. And the last check is for carpal tunnel. You're going to go ahead and place your hands like that. Maybe pull back just a little bit. And do you sense any tingling or anything like that? Okay, she'll hold that for 60 seconds. If she does have tingling or something of that nature, it would be considered positive. Okay. We're going to go ahead and check her back now. So if you want to stand up straight, if you could. All right. And if you can go ahead, I mean, everything looks fine. She has good posture. If you want to go ahead and bend over just at the waist, she should have the normal C-spine, which she does. Okay, you can come back up. All right. Also, can you switch with your hips from side to side? And also twist. Okay. Do you feel any soreness when you do that?
No.
Okay. Okay. If you want to have the seat back, I'm going to go ahead and check your lung sounds, which I'll go ahead and check your posterior area first. Okay. Basically just noticing her on assessment while I'm doing everything. She has even unlabored respiration, so you know something that you already catch when you first start talking to her. And I'm just going to go ahead and listen for her breath sounds. So, and we want to compare side to side. So take a deep breath. Deep breath. Deep breath. Deep breath. Another one. Now, of course, I wouldn't be doing that over a shirt in real life. You would want to try to do skin to skin, but basically her lung sounds are clear and slightly diminished in the bases. Okay. We're also going to take a deep breath. Okay, let go. All right, so everything is fine as far as posterior. And I'm going to go ahead and check the front. Okay. And of course, we would check the skin to skin when we go to check this. Take a deep breath. All right, and while I'm up here, I'm going to go ahead and just listen to the apical pulse. Which I'll listen to for about a full minute just to make sure I don't hear anything different. And of course her chest wall, I mean there's no deviations with that or anything. And then I'm going to go ahead and listen to her heart sound. So I'm going to come down from the clavicle line. I'm going to listen to the first heart sound. And of course I'll stay here for a while. Sticking to your shirt. Okay. So there's usually 5 different areas that you're going to check for that. And then we're going to, which she is sinus rhythm, about 72. So that's where she's going with that. And as far as the self-breast examination, have you ever done that for yourself?
Yeah.
You have? Okay. Do you know the time that you're supposed to do that? Yes. Okay. And let's see here. Well, basically, it's done best on the 4th through 7th day after your menstrual cycle, or of your menstrual cycle, and that's when your breast is the smallest and least congested. You can start in the shower. It's soapier. The water helps your hands glide better. You want to check in the mirror, go like this to make sure. Of course, your left breast will be bigger usually, so that's a normal finding. And if you can, sometimes they say to lay down as well, but you're going to check, especially up in your right underneath your armpit area. That's mostly where you need to especially pay attention to any type of lumps. You can go up and down, across, make sure your nipples aren't having any type of drainage. If you feel any lumps, any drainage, you need to call the doctor and let us know. You can also work in a circular motion out, and you can also just work from your nipples out. Okay, so you can do it any one of those ways. Okay, and as far as checking out your abdomen, if you want to go ahead and lay down on the table. Basically what I'm going to do now with your abdomen is, obviously it's flat. Have you had any pain in your abdomen?
No.
Last bowel movement?
This morning.
Okay, so, you're obviously regular with your bowel movements. So basically I'm just going to go ahead and listen for your bowel sounds. And this would be skin to skin again normally, so. Okay, and also I'm going to check for any type of vascular sounds as well. Which we shouldn't hear any type of vascular sounds. If we would, then there may be an issue and we need to notify the doctor right away. Okay, and then I'm also going to percuss all your quadrants. So, okay, and then I'm going to feel for your liver. So I'm going to just place my hand right here under your rib cage. Can you take a deep breath in and let it out? All right, and you can feel her liver whenever she breathes in and out. Okay. And I'm just going to palpate the aorta as well. Check and feel it right there. So while you're laying down, I'm just going to go ahead and check. Have you noticed any change in your legs as far as swelling?
No.
Okay. Just looking at her legs, it doesn't look like she has any type of edema, so I can't really give her any type of a score for that. But I'm going to check her inguinal loads, which she doesn't have any type of issues with that. Okay. I'm also going to check her femoral pulse. We'll give that a +2 over the genes. Popliteal pulses. Say about +2. Wiggle your toes for me. Okay, she has good movement in her feet. Pedal pulses. +3. Post-tibial pulses. +3 also. Okay. Put your shoes back on for you.
Do these things?
No, you're fine. Okay. Now we're going to check your range of motion. So if you can go ahead and raise your right leg just straight up. Okay. Bend at the knee. Okay. Try to pull your leg towards your chest with your hands. Okay. And now try to relax your leg off to the side. Does that hurt? Okay. And go ahead and put that leg down and repeat with the other leg. Okay. Bend at the knee. Pull it to your chest. And go ahead and let it relax outward. Okay, any pain with that?
No.
Okay, if you want to go ahead and sit back up. I'm going to go ahead, this is just, we're almost done, so I'll go ahead and just check. Does this hurt at all? Can you feel it? Sense, okay, that's good. Go ahead and check this here. Let me see this in the pockets. Okay, all right. So basically what we're going to do here is check her joints. Can you feel that? Yeah, you feel it there? Okay. All right. All right, if you want to go ahead and close your eyes, open up your hands. Go ahead and tell me what that is.
Paper clips?
Very good. Okay, so we got that good. All right, so now I have some confusing things for you to do. I want you to alternate, touch your nose with every other finger. Okay, all right. Touch your finger to my finger, then touch your nose. Okay, and touch every finger to your thumb. Okay, very good. Okay. While you're sitting there, if you can go ahead and run your heel down your center of your leg. Okay, do it with the other leg. All right, you feel sensation there?
Mm-hmm.
Okay, and if you could just cross your legs over your knees. Okay, all right, very good. All right, and then what I'm going to go ahead and just check your reflex. I know, this is the most exciting part of the exam. So, okay. Okay, your knee. All right, you have excellent reflexes. Very good. All right, if you could just stand up for me now. This is almost done. Okay, if you could go ahead and just walk in a straight line, heel to toe. Okay. All right, that's good. Now we're going to walk back this way on your heels. Okay, and then tippy toes. All right, very good. All right, can you bend your knees just a little bit? A little bit more. Okay, up. Bend again. All right, can you hop?
Can I hop on 1 foot?
Fantastic. Okay. All right. What we're going to go ahead and do now is, if you can just stand straight with your hands out. And then flip them up under them. Okay. All right. Hold that for 20 seconds. Okay. And the last thing is we're going to check for scoliosis. I don't know if you've ever had those done when you were in school. Usually they check when you're an adolescent. So if you want to just go ahead and bend. Okay, and you check the spine for any S-curves, which there aren't any. She's doing good. All right, and come back up. All right. Do you have any other questions?
No, I don't.
Okay, well, the doctor will be in to see you shortly, and I'll go ahead and let him know about the thyroid, okay? All right, you have a good day.